welcome back to another cue card discussion. So today I'm here with 𝗂𝗶𝗍𝘀𝘁 and today we are going to discuss a cue card where the setting is a community health center.
And you're talking to a celiac disease patient who is pregnant and is concerned of passing this disease to her offspring.
Absolutely. And she's so concerned whether this will be inherited by her child, unborn child as well.
Yes.
So you need to provide all the information that she needs to know. So I'm going to play the part of the nurse and Grace will be handling the part of the patient.
So I hope they will get lots of reassuring statements from this cue card.
Absolutely. Let's try. Okay, so without much ado, let's get started with the role play.
So your time starts now.
Good morning.
Good morning.
Please be seated.
Thanks.
I'm the registered nurse working in this community health center. Please call me 𝗏𝗏.
Okay.
How can I help you today?
See, I have been diagnosed with celiac disease and currently I'm pregnant. So I'm really afraid of passing this disease to my child who is unborn. So I would like to get some details regarding this condition and what can I do for my child.
I'm sorry to learn that you're unwell and I understand your concerns and queries too. So I assure you that I'll do my best to give you all the information that you need to know.
Thanks.
So before we proceed further, could you please tell me your name and age?
I'm Sarah and I'm 26 years old.
All right, Sarah. So before we get into further discussion, you told me that you've been diagnosed with celiac disease, right?
Yes.
So what is your understanding of this disease?
I have no exact understanding of the disease, so I would like to hear it from you.
Sure, I'll explain that to you in very short, okay? So celiac disease is an immune reaction to gluten, eating gluten, okay? So I hope that it is clear for you.
Yes.
So do you have any other concerns worrying you?
Yes, I am only concerned about passing this disease to my child.
That's a very reasonable query from your side, and I do understand that as a pregnant woman, this is bothering you so much. You're really concerned whether this will be passed on to your baby as well. I totally get it. And I'm not trying to worry you here, but it is a fact. And I'm sorry to say that celiac disease can be inherited. If the mother has the genes of celiac disease, the probability of the child getting it is 50%. I don't hope that you get the seriousness of the condition.
That's a shocking news, really.
I know it comes as a shock to you, and it is not a very happy information that I'm passing down to you as well. However, if at all it gives you any peace of mind, I can suggest you some ways to minimize the risks involved in it. Shall I take you through that?
Yes, please.
Lovely. So the first thing that we need to try to do is to have a gluten-free diet during your pregnancy. So in order to help you with that, I can make an appointment with the hospital dietitian so that he can help you in selecting a proper diet for you.
Okay.
Will that be okay?
Oh, sure.
Lovely to know that. And then in order to be on the safer side, or in order to get to know what exactly the status of the baby is, I would suggest you to take a genetic test for the baby.
Okay.
Because we can have an early detection. Okay, and touch wood, if your baby has this celiac disease or whether it has been already passed on to your fetus, then we can start with the initial treatment too.
All right.
And once the baby is here, make sure that you breastfeed the baby for at least 6 months.
Okay.
And introduce gluten to the baby slowly between 4 to 6 months of time. All right. And it is very important that you watch out for any symptoms of celiac disease. Okay. By this time, you will be knowing what are the symptoms, right?
Yes, I know that.
So make sure once the baby is here, you watch out for the symptoms of celiac disease as well. Okay. So if you follow all these instructions to an extent, we can reduce the risks involved in it. I hope that is clear for you.
Yes.
Yes. Moreover, I would also like to tell you the importance of the gluten-free diet. I told you that once that you need to have a gluten-free diet during your pregnancy time, right? So it is very important. The reason I'm repeating that is because if you include gluten in your diet, it can cause complications like infertility, miscarriage. Okay, and it is not a very pleasing information, right? So it is very important that you avoid gluten. So a gluten-free diet will be better for you. Okay. So I hope I have cleared everything for you and you received all the information. So do you have any other questions?
No.
All right. So I would also like to advise you to consult the doctor to get information about the nutritional supplements so that you can make a proper diet for you. Okay. And I would also like to tell you one more thing. I do realize that it is a very difficult situation for you and you're unhappy to know about this particular condition and the probability of it being inherited to your child as well. I totally get it. But all you need to do is to stay committed to a gluten-free diet. Okay. And you need to seek medical advice in case of any medical emergencies as well. Do not take anything lightly. Make sure that you're always vigilant about it. Okay. So I hope I have been helpful for you and you got all the information that you needed from me, right?
Yes.
Okay. So is there anything else I can help you with?
Nothing more.
Well, so that's all from my end. And if you require any further information, feel free to contact us. Okay.
Okay.
Take care. Bye-bye. by that we have come to the end of this discussion, and I hope it was very clear for you guys. So as you guys have seen, we were talking to a 26-year-old pregnant woman who has been diagnosed with celiac disease, and her main concern was whether it might be passed on to the fetus, right, to the unborn baby, and she is so worried about it. And we have to provide a lot of emotional support, and we have to explain details clearly to her. So in this case, we have seen that there is a clear-cut 50% chance that the baby might get it, the offspring might get it. So there is no other option. We have to inform that to the mother.
Yes, but and we were not giving any false reassurances here.
Yes, so we have to let the mother know and make her accept the reality, and then provide emotional support too. So we have shown you in this role play how you can explain a very unhappy news and then suddenly deviate that thought process into something hopeful. Okay, so if you have seen in this particular cue card, there is a task where you're explaining to the mother that there is a probability, a 50% probability it might be inherited, right?
Yes.
And then suddenly the next task is where we are giving ways about how to minimize the risks involved in it. So we have shown you very clearly about how we can explain an unhappy news to the parent and then suddenly deviate her thought process into something hopeful. So I hope it is clear for you guys. So we have shown a very clear-cut explanation about how you can handle this particular patient, and straight after this role play there will be a feedback session about how to create statements for each task, and make sure you guys watch it. So Grace and I will come back with another role play very soon. Until then, take care. Bye-bye.
Bye.
Hello everyone, welcome to the feedback session. My name is 𝗁𝗶𝗀𝘆. I'm one of the expert OET trainers from IILT. So we just watched a video, a role play demo, where we are talking to a pregnant woman who has been diagnosed with celiac disease. And we have seen how we can build that conversation and move from one task to another and everything like that. So in this particular session, I'm going to show you how you can do that in a similar way. So I will show you how you can construct the statements, and I hope this is going to help you. So let's get started with the feedback session. Alright guys, so this is the cue card. You can see the setting which is given as a community health center, and we have a very tiny explanation in the column of background details. So let's read that, okay? So it said you're talking to a 26-year-old pregnant woman who has the inability to handle gluten, celiac disease. She looks very upset and worried, and we have all the tasks given there too. So the first task is to greet the patient and inquire about the reason for the visit. So from this particular explanation, it is clear that it is an unknown case. We do not know this person before, or we do not have any sort of prior conversation to this particular pregnant woman. Okay, so this has to be treated as an unknown case. So let's see how we can start this conversation, or how we can have an opening statement. Okay, so let's move on to task number 1. Greet the patient and inquire about the reason for the visit. So this is one way of doing it. Good morning, my name is 𝗁𝗶𝗆𝘆. I'm one of the registered nurses working in this community health center. How can I help you? A very standard way of asking it, okay? Or you can try this after replacing how can I help you. You can even try this. You seem to be really upset about something. Is there anything I can do to help you? So I would personally tell you to go for the second one, because that shows that you were actually focusing on the emotional aspect of the patient and you gave more importance to that. So if you see someone looking really upset and worried sitting in front of you, definitely you will be questioning that particular point, right? So in this particular role play also, it is good if you can relate to the emotional context of the patient. Okay, so this will be a better option. This is also good. Okay, I'm not saying how can I help you is not the right way to do it. You can, because it's a very standard way of doing it, but this is also a little more beneficial or effective. So the patient is going to say something like this. Okay, this is just a demonstration. So imagine the patient said, like, I have been diagnosed with celiac disease and now I'm really worried whether it will affect my unborn baby. So she explained her concern. So you have to remember the structure in your mind. Like after the introduction, what we have to do is we have to ask the concern of the patient, and once the concern is being told to you, you have to assure it, or you have to acknowledge that particular concern. So let's see how we can do that, and that is your task number 2 too. Okay, you have to provide emotional support and then offer to help. So let's see how we can do that. something like this. I can sense how upset and worried you are. Please set your mind at ease. I will provide all the information. See this portion till here. I can sense how upset and worried you are. Please set your mind at ease. That is the emotional support that we are giving here. Then if we look at this portion, I will provide all the information, that is the help that you're offering. So the patient says something like this. That will be great. Okay, now we are moving on to the further discussion, that is our further tasks. Before that, we need the name. We haven't asked the name from this particular person. So this is a very simple way of doing that. You can use this, okay? For my documentation, can you please tell me your name? So she's saying, I'm Maria. And you have to give a small, very cute response like, all right, I see, I understand, something like that. Okay, make sure that you are responding there. So let's move on to task number 3. Task number 3 says something like this. Explain celiac disease and immune reaction to eat gluten. Okay, so it's a very simple and a short task, and let's see how we can elaborate that into a little bit of a detailed explanation. So here we are doing something like this. Before we get into further discussion, okay, could you please tell me what you know about celiac disease? This portion is important because if you have read the assessment criteria, in the clinical communication criteria, they have clearly stated that you have to explore the feelings and concerns and expectations and ideas of the person, of the patient, okay? So it is very important. You have to check what the patient knows about any condition, or if you're going to explain a procedure, check with the patient whether the patient knows anything about the procedure, because you need to understand the awareness level of the patient, and it will help you to develop your conversation too. And also, if the patient has any false information, it is your responsibility to correct it and give the right information too, okay? So for that reasons, or for these reasons, it is important that you always check what the patient knows. So you have to explore what the patient knows about this condition. So that is the question that I have asked here. So the patient is saying, I just know that I'm not allowed to eat gluten. So the nurse is going to say something like this. That's right, Maria. It's an immune reaction to eating gluten. If you have celiac disease, eating gluten triggers an immune response in your small intestine. Are you following me? It's a very simple explanation you can give for celiac disease, because it is clearly mentioned it is an immune reaction to eat gluten, and then the other details will be known for you because you might be aware about that too. So if you know more details about this, you can elaborate, because this is a pretty short task which is given here, and we don't have much of the bullet points too. So if you want to give extra explanation, feel free to do that. Just make sure that it is correct and you're not going overboard. So this is a very simple explanation that you can do, and you can ask a question, are you following me? This is also important, okay? These short questions really help to boost your score, because if you are going through the clinical communication criteria, all you can see is how important it is to check the understanding of the patient, how important it is to check what the patient already knows about it, or how the patient is feeling about a suggestion that you have said. So these are the points that will get a lot of score. So make sure that you don't skip small questions like this, okay? Ask wherever required. So the patient is saying something like this. So my main concern is whether it will be passed on to my baby. Okay, that's a good question from the patient's side. So let's see what we can answer, okay? So task number 4. When asked, explain it can be inherited. Mother has the genes of celiac disease. Therefore, 50% of chance for the unborn baby. Okay, so this is the point that we are going to explain, and this is how we can do that. And this sentence construction is a very different one. This is not a very common statement that I have often seen. So if you would like to try something new, and if you would like to build your proficiency level, then try this. This is a really good way of saying higher chances, okay? So let's see how this is built. So you can say, that's a reasonable question, Maria. Acknowledgement, okay, that's good. And then we are going to say, studies have found that the unborn babies are at an elevated risk of developing celiac disease if the mother has the same. See that? Unborn babies are at an elevated risk of developing. That means a higher chance, okay? Like the chances are really high. So this is a really good sentence construction that you can use to show that there are higher chances. Okay, so next time onwards when you are doing your role plays, try to incorporate this particular statement if you are very convenient or if you are comfortable with it. So this is a really good sentence construction that you can say. Let's read that again. That's a reasonable question, Maria. Studies have found that the unborn babies are at an elevated risk of developing celiac disease if the mother has the same. Okay, then if you want, you can add a lot of points here, like, and it is obvious that you have to provide emotional support, and that's what we are going to do in task number 5, because we are going to empathize with the mother and suggest ways to minimize the baby's risks. So let's see how we can do that. As a continuation from this point, okay, this is how it is going to go. I know it's very hard for you. Please be relaxed. There are various ways to minimize the baby's risks. If you don't mind, I can explain everything in detail for you. So the patient is saying, yes, please, that will be really helpful. So you can start by saying, to begin with, again, okay, these are really good usages that will boost your score, showing that you have a good range of vocabulary too. To begin with, a gluten-free diet is highly important, especially during pregnancy. This is the point which is mentioned, gluten-free diet during pregnancy. So I just changed it like this. A gluten-free diet is highly important, especially during pregnancy. I would also recommend a genetic test for the baby as to know whether he or she has been affected by celiac disease. Is that okay? Okay, so this point, genetic test for the baby, early detection. So this is a point you can explain. I would also recommend a genetic test for the baby as to know whether he or she has been affected by celiac disease. Is that okay? So the patient is saying, yes, that's okay, I'll remember to do it. So the nurse is going to explain few more points. You can try something like this. Please note that you breastfeed the baby for at least 6 months, and slowly between 4 to 6 months you can introduce gluten. Are you following me? Okay, so I clubbed these 2 points together. Okay, then we have one more point which is left out. So are you saying I can give gluten to my baby? So the patient is going to raise a question. So you're saying yes, but please make sure you watch out for any symptoms. Okay, watch out for symptoms. So the patient is asking, like the same I had. So you can confirm by saying yes, please. Okay, because the symptoms would be kind of like similar. So you are going to give an answer like that there. Okay, so this is how you can do it. Now if you have, if you look closely here, you can see small questions like this. Is that okay? Are you following me? Okay, these points. So if you have noticed it, I made sure that I have paused in between while I was giving the suggestions, because after I spoke about having a gluten-free diet and a genetic test, I paused and I checked with the patient whether it is okay, and then I explained about breastfeeding for 6 months and introduced gluten to the baby for the baby at that point, and then I stopped it and I paused. Okay, I paused and I checked the understanding of the patient, and then at last I spoke about watch out for symptoms. So this is a very effective way to maintain clarity. So whenever you're speaking, make sure that you decide on where to pause, interact, or ask a small question to the patient, and then carry over with your explanation. Okay, so that is how you can do it. Now let's look at task number 6. Stress on the importance of gluten-free diet to avoid complications in fertility miscarriage. Now we have explained a lot of points, so let's see how we can give more information related to the same topic. So I'm going to use this point. On top of all these, I would like to bring it to your attention that it is very important to follow a strict gluten-free diet to avoid complications such as infertility or even miscarriages. I'm not trying to worry you. I have your best interests at heart, and it will be good if you know the seriousness of the situation. Okay, see, that's a very simple and very elegantly constructed there. Okay, so what you can do is you can look at these vocabs that I have used, or the connectors. Okay, I would like to bring it to your attention. Okay, so normally we have always seen people saying, I would like to explain this to you, I would like to tell you this. So this would be something else. So I would like to bring it to your attention. Yeah, that means that you want the patient to listen very actively there. Okay, and you are saying that it is very important to follow a strict gluten-free diet to avoid complications such as infertility or miscarriages. So here the point is mentioned, So I know it is a very upsetting or a very negative information that you're telling. So this will be a very safe way of explaining something which is unpleasant. Okay, so you can read through that and you will get an idea about it. So patient is saying something like, yes, I get it. And you can ask, do you have any other concerns or do you have any concerns? So she's going to ask you about, what about my pregnancy supplements? So that is what we are going to explain in task number 7. That's our last task. Advise her to consult the doctor about nutritional supplements, encourage the mother to stay committed to a gluten-free diet, and seek medical advice in case of any medical emergencies. So the nurse is going to start like this. Regarding that, because she asked about the pregnancy supplements here, so we are saying regarding that, Maria, I strongly suggest you to speak with the doctor. He will give you more insights about nutritional supplements. The only thing you have to be considering is to follow a gluten-free diet without fail. So the patient is saying, I'll do that at any cost. So the nurse is saying, I'm very pleased to hear that. Feel free to contact us in case of any medical emergencies. Okay, so this is a very simple yet very good, like, very informative kind of a cue card where you're providing and educating the patient about celiac disease and what are the things she has to do, what are the things that she doesn't need to be worried about, because we're dealing with a pregnant woman and she's superly concerned about her unborn baby having the same condition, and we do know that the chances of the baby having the same is really high too. So when you're explaining the points, if you can recall, the sentence that I've used here is something like at an elevated risk, okay, to indicate a higher chance. So if you can learn and pick certain usages like that or some sentence constructions like that from this particular session, I hope it was helpful for you guys. And make sure that you make a note of these statements which are new to you and you learn it and try to implement that in your speaking sessions too, so that it will be more effective. Alright, so by that we have seen how we can construct statements and move from one task to another, and I hope it was clear for you guys. So don't forget to post your valuable feedback and suggestions in the comment section, because we'll definitely look into it. And I'll see you guys in the next video. Until then, take care. Bye-bye.
IILT, it's my cup of tea.